Hello, I will be presenting an effectiveness study looking at laparoscopic hyperthermic intraperitoneal chemotherapy, also known as laparoscopic HIPEC. Cytoreductive surgery and HIPEC are treatment options for a number of cancers with peritoneal metastases, including mucinous appendiceal neoplasms, peritoneal mesothelioma, colorectal cancer, and ovarian cancer. Laparoscopic surgery has been shown to be comparable to open surgery for many oncologic resections. Currently, cytoreductive surgery and HIPEC are primarily performed with an open abdominal incision. This is largely due to the extent and variability of the surgical resection required. In order for HIPEC to be most effective, the goal is to achieve complete cytoreduction, which means there is no visible tumor remaining. The amount of resection varies widely depending on the tumor burden within the peritoneal cavity. Laparoscopic HIPEC has been performed at Ascension St. John Hospital and other institutions around the world. Some studies have reported good surgical outcomes for laparoscopic HIPEC with cytoreductive surgery, especially for mucinous neoplasms of the appendix, select gastric cancers, and low-volume, low-grade colorectal cancer. We believe the number of patients undergoing laparoscopic HIPEC has been underreported. We postulate that proper patient selection and the optimal technique could lead to an approach where more patients undergo laparoscopic cytoreductive surgery and HIPEC rather than open surgery. We wanted to know what is the effectiveness of laparoscopic HIPEC in select patients, and what is the effectiveness of laparoscopic neoadjuvant HIPEC in downstaging gastric cancer with peritoneal metastasis. We conducted a retrospective chart review of all adult patients who underwent laparoscopic HIPEC from January 1st, 2013 to December 31st, 2020 at Ascension St. John Hospital. We collected patient demographics, diagnoses, the peritoneal carcinomatosis index for each patient, also referred to as the PCI, which assesses the extent of peritoneal cancer in 13 regions within the abdomen, taking into account the size of the lesions. Each region is scored 0 to 3, and the maximum total score is 39. We also collected the chemotherapy agent used, type of resection performed on each patient, length of surgery, and outcomes including length of stay, morbidity, and mortality. Descriptive statistics were then calculated. Here are a few examples of laparoscopic HIPEC. With open HIPEC, a very large incision is made from the xiphoid process to the pubic symphysis, which can be fairly morbid. With laparoscopic HIPEC, smaller incisions can be made. You can see here there are two smaller incisions that contain the inflow and outflow catheters to circulate intraperitoneal chemotherapy. This is performed after cytoreductive surgery has been completed for a duration of 60 to 90 minutes depending on the type of cancer and chemotherapy agent being used. In total, we had 8 patients who underwent a single laparoscopic HIPEC operation, 4 of which had low-grade mucinous neoplasm with perforation of the appendix, 2 had adenocarcinoma of the appendix, 1 had colon adenocarcinoma, and 1 had peritoneal papillary mesothelioma. 1 patient underwent 5 neoadjuvant laparoscopic HIPEC operations for gastric adenocarcinoma with positive peritoneal cytology. Either mitomycin C or cisplatin, or a combination of the two agents, were used for all patients. 4 patients had laparoscopic HIPEC only without the need for cytoreduction. In other words, they had a PCI of 0. 5 patients underwent laparoscopic HIPEC plus single or multivisceral resections. The patient who underwent neoadjuvant laparoscopic HIPEC for stage 4 gastric adenocarcinoma had downstaging of their disease and later went on to have open HIPEC with R0 resection. The mean age was 50.7 years. 38% of the patients were male and 62% were female. The PCI ranged from 0 to 8, and the median PCI was 2. There were no conversions to open procedures, and complete cytoreduction was achieved in all patients. The mean operative time was 5.4 hours. This includes the 60 to 90 minutes of chemotherapy. The mean length of stay was 3.7 days. There was no 90-day mortality nor readmissions. In conclusion, we believe that the laparoscopic approach should be considered in patients with peritoneal metastases with low PCI scores. With low PCIs, they are more likely to have a successful laparoscopic HIPEC and achieve complete cytoreduction without requiring conversion to an open procedure. Additionally, neoadjuvant laparoscopic HIPEC may be an option to downstage positive peritoneal cytology that can be followed by definitive therapy. Further research is warranted to investigate this minimally invasive approach to cytoreductive surgery in HIPEC to confirm its benefit in these patients and evaluate long-term outcomes. And here are my references. That concludes my presentation. Thank you.